Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism, along with my co-hosts Ron Bachman and Jonathan Field. So welcome back to the segment. And joining us today is Mike Martin, Chief Executive Officer with the Karis Group, out of Texas. Hey, Mike, good morning to you.
Good morning. How are y'all today?
We're doing great. Hey, appreciate you taking time out of your day to join us.
My pleasure.
Hey, tell us, our audience, a little bit about the Karis Group and your Care 360 program.
Sure, I'd be happy to. The Karis Group was founded in 1996. We're a healthcare professional services firm in Austin, Texas. We work in all 50 states, and we are driven over these years. Our mission is to make healthcare work for everyone in our country. So that's really what drives us. Our founder, who was a medical doctor from England, he and his wife were both medical doctors that came to the United States, and saw some challenges in the healthcare system, particularly with pricing and affordability for American families. So they really set up the Karis Group to be able to work to assist people with their medical bills, getting to fair pricing, and assisting them in those areas. And we've expanded that a lot over the years to be a more comprehensive service program.
So talk a little bit specifically about Care 360.
Yeah, this is a product that we've rolled out a few years ago, the Care 360 product. The idea was really out of the chaos that was surrounding a movement to the Affordable Care Act. A lot of uncertainty in the marketplace, but particularly with individuals and families or group plans, employer groups trying to figure out which way to go, how's this going to work. We had for 14 years been helping people with their medical bills, and so we were frequently asked questions a few years ago about, well, could you help me with questions about the Affordable Care Act and penalties and exchanges and those sorts of things. So we expanded our product to Care 360 with the cornerstone being a comprehensive healthcare navigation service. What we wanted to be able to do is be a repository of information and assistance to members who could come in and say, look, I need this help, I don't understand this question, or I don't know where to go. And we basically take over the process and develop solutions for them, anything in the healthcare arena. So we, whether there's someone's just looking for a physician, or they don't understand something in the Affordable Care Act, or they have a claim with their insurance policy that's gone awry, or they need a second opinion referral center, appointment scheduling, whatever the needs are, we decided, look, let's go out and help people because, A, they don't have the time. The American family today doesn't have the time. But probably more importantly, they don't have the wherewithal. And unfortunately, in the absence of really informed consumerism, what you see is a lot of people being taken advantage of, not necessarily intentionally, right, but just because the system doesn't assist them. So we said, here's a place where we can really help people by providing them good information to make informed, educated, rational choices. So that's what really propelled us to create Care 360. And then built into that, we had a couple of other products that we just thought were essential to helping them. So our Care 360 advisors will, if you will, triage a case when a member calls in. And most of the time it's a navigation service, but a lot of times a member will say, well, I owe $25,000 on a surgical procedure that I had to the doctors, several doctors, some hospitals, et cetera, and I just can't afford to pay those. Well, our patient advocacy service will take over those bills and go negotiate or mediate with the healthcare providers on those bills to bring about some resolution that's affordable for the member. It's a good, works well for the provider. They're trying to collect on it, and the member is trying to get some relief. So we mediate and bring about savings to their bills. Then the next piece that we found really helpful was surgery cost saver, which we built into Care 360. This is actually, it's a healthcare facility comparison report. A member would be a doctor, a surgeon would say, well, you need to have your gallbladder removed. We're going to send you over to Hospital X. we'll get you scheduled there. Well, most people just simply go, not knowing what the cost is. And then they come home, and a few weeks later, all these bills start arriving, and they're sitting there, well, how am I going to pay for this? So what we do is our registered nurse on staff, when a member calls in and says, I'm going to have this non-emergency procedure, then the nurse visits with them and then goes back to the surgeon and visits and gets more information, and then actually calls the facility where they've been scheduled and gets actual pricing information. I don't know your experience, but over the years, in my own life, trying to find out actual pricing is extremely difficult, and a lot of the published data is out of date, or the metrics really don't work. So we find the actual pricing for the facility, and we look at availability that fits the member's schedule, not just the facility schedule. And then we also look at quality metrics to make sure they're getting a good quality for value. And then the nurse would take that as a baseline and then go compare it and get 4 other facilities to give an opportunity for informed consumerism. And that comparison, what we've found in the 5 facilities overall in the past couple of years, on average, we find that there's a 64% price differential among the various healthcare providers when we're doing a comparison, and that amounts to an average savings of about a little over $13,000 per case for our members. So this is where we find a sweet spot, helping people make that choice. And of course, we're saying, quality is, the quality is equal, but here's a significant price differential. It's your choice, but here's where you could save yourself a lot of money. So that's the kind of thing we want. We want to help people be educated, informed consumers, but most people don't have the time. So what we basically do is do all the legwork for them.
Now, Mike, do you deal directly with the employer on, putting the service in place for their employee population? Is that?
We do. Admittedly, that's not our most heavy market, but we can certainly do that. In fact, this surgery cost saver was developed for the self-funded employer group, because so many of the self-funded employers were just really getting hit hard with employees and or their family members going out and having a surgical procedure, and then the bills come in, and the employers just got to pay those. So we developed this really for those groups as a way to incentivize their employees, either through savings sharing or some sort of incentivization to use the service, and then ultimately it saves the employer group significant dollars.
Mike's Ron Bachman here. What is your business model? Is this potentially sold to individuals? Is it just sold to large companies, small companies, help the uninsured? What's your business model?
Well, initially, Care 360 was created as a direct-to-consumer model, and we sell it at a retail price on the Internet, so anyone can come and join. Our normal business model is really selling through insurance wholesalers, aggregators, resellers, to where we're selling to larger groups, and so, but we'll do both. But right now, the primary market that we're experiencing seems to be with larger groups buying Care 360 for a lot of people. We have a client that recently that they've enrolled over 60,000 people just in about the past 5 months. It's an unrelated product. They're actually selling a major medical policy, but they saw value in what we were doing for their members, so they've included in all their policy memberships across the board. So we're really flexible. We can work with the individual on a retail basis. And they can go to www.care360.com, or we work directly with employer groups or with, again, these aggregators and wholesalers around the country. And another big marketplace for us is the employee assistance programs. Those groups that are going to employers and putting together a package of benefits. One of the things we're seeing, there's a lot of interest here where the pricing works well because of the larger numbers, and they're able to include that as a choice option for employers. And I think our experience with employers is they realize that most of their employees are spending time on the company clock, if you will, to address these issues in their lives, because the healthcare providers that they need to talk to are not there after hours.
Right.
So if I'm working during the day, my employees are back, they've got issues, they're on the phone during the day, I'm paying for that. So these groups are saying, wow, that helps our productivity as an employer, because my employees can turn their case, their problems over to Karis. Karis works it out, brings back a solution. They're not on the phone trying to negotiate all these and work all this. So it lowers their stress level and increases their productivity. So we're really in a lot of different markets, to be honest.
Hey, Mike, are you engaged with any of the emerging private exchanges? I would see this as a natural part of that complete solution.
We haven't yet. Frankly, the growth that we've experienced just in the past 2 years, we're working on handling that and handling it well. It is something we have looked at, but haven't gotten there yet. And frankly, we're kind of watching to see where the Affordable Care Act goes, because not all of their details have been worked out. Not everything's been implemented, so part of it is we're waiting to see if it settles down a little bit more, and then we would certainly address that market.
Well, Mike, we got about time flies when we're having fun, and a lot of information here, a lot of good information. We got about a minute to go. Can you kind of wrap this and leave our audience with some takeaways, please?
Sure. I think the key, what we try to do at the Karis Group with Care 360 is to help the consumer navigate the healthcare waterfront, if you will. People just don't have any idea, and unfortunately, without professionals assisting you at a very affordable price, you're left really to the whim and will of the healthcare system, and it's not geared for individuals. So it's geared for the Medicare system, and it's geared for large insurance companies, but everybody else really has to fend for themselves, and that's where we really make our best play. We help people save money, save time, cut their stress. We're a service company, and we consider ourselves a concierge service, to where we do all the work for the members.
Well, Mike, listen, I really appreciate you taking time away to spend with us on this segment. It's been very informative.
Well, thank you so much for your interest, and I really enjoyed talking with you both.
Yeah, have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumers.
Great. Thank you all so much.
All right.
Bye-bye.